Hello, nursing class. I'm Robert Dorfman, and I'm going to be presenting my integrated review of literature on the effect of peer mentoring interventions on diabetes control in African Americans over 50. And diabetes is an epidemic that's getting worse in this country, and this study is going to focus on type 1 and type 2 diabetes. Nurse administrators have to find a way to help facilitate best practice in their institutions, especially with the growing number of diabetics locally and nationwide. We have to look to the current literature and see how best to serve those populations. In the case of diabetes, it's a disease that affects people considerably more as they get older, and African Americans much more than the Caucasian population. This was led to the investigation to see how well peer mentors could help educate and assist people with their diabetes management over time. An ideal peer mentor, as we continue, is someone who is diabetic and of a similar demographic to the patient receiving help, that is well trained in providing coaching, goal setting, support, and education to a patient instead of a doctor, nurse, or medical provider in the view of this integrative review. There's numerous evidence to support this. Incidence of diabetes in African Americans is 75% higher nationally. And as people get older, it goes from 4.1% in young adulthood to 26% as you get over 65 years old. In Kentucky, morbidity rates are considerably worse than the national average, and even more so for African Americans, where the numbers go to 44.9 deaths out of every 100,000 to 57.1 for males, and nearly a 40% jump of 35.8 to 49.7% for African American females. In addition to the stats on diabetes itself, there's numerous comorbidities as we continue. Heart disease, hypertension, stroke, blindness, and kidney failure, in addition to lower limb amputation. The stats on these are staggering. 71% of diabetics had high blood pressure and were using medication to treat it. Cardiovascular disease death rates were 1.7 times higher, and heart attack hospitalizations 1.8 times higher. As we continue with stroke, the incidences are 1.5 times higher for hospitalizations, and 1/3 of diabetic patients had some kind of retinopathy or vision loss. Kidney failure was 44% of new cases of those with diabetes, and 60% of non-traumatic lower limb amputations are from diabetics. And financial costs, being the 7th leading cause of death in the country, direct medical costs are $176 billion a year, and indirect costs from disability, work loss, and premature death are $69 billion. As we continue on page 13, there are national and local initiatives to help address these problems. As a part of Healthy People 2020, the Office of Disease Prevention and Health Promotion hopes to reduce the disease burden of diabetes and improve the quality of life for those who are or could be afflicted by it. They also aim to track health disparities, including those resulting from race. The U.S. Department of Health and Human Services has made it a priority to use data to improve the health of minority populations. The National Institute of Nursing Research's strategic plan has made it a goal to improve quality of life and symptom management in acute and chronic illness, of which diabetes is. And on a local level, the Cabinet for Health and Family Services in Kentucky has made it a goal to increase the availability of evidence-based self-management education and other behavioral initiatives to help control diabetes. These play a large part in looking at the research on peer mentoring with diabetes in African Americans. Now, let's move on to the studies.